Hi, I'm Wendy. Welcome to Baby on Board. This week we will be talking about starting breastfeeding, including latching and the benefits of breastfeeding. So why breastfeed? Well, studies have shown that your baby's IQ will be up to 10 points higher if breastfed for 6 months. Other benefits are baby is a lot less likely to get infectious diseases such as gastroenteritis. This is due to the antibacterial properties in breast milk. Diseases of the immune system such as asthma and eczema are also a lot less common. The other benefit is that breast milk is very economical for the family, it's always the right temperature, it's on tap, and it's a complete food for baby. There are also a lot of benefits for mum. Breastfeeding will help protect you against ovarian and breast cancer. And when you're breastfeeding, the love hormone oxytocin is released as you breastfeed, and this will help you bond to your baby. Another benefit is that it helps you lose the baby weight. A lot of the weight you put on in pregnancy is fat laid down for around 6 months of breastfeeding. From an environmental perspective, there are no bottles going to landfill. Breastfeeding is free range and organic. Formula feeding is expensive. And if you manage to get breastfeeding established, you will save your family the cost of formula feeding. It can take 4 to 6 weeks to get your breastfeeding established, but once it is established, it starts to become quite easy. So if you're experiencing any difficulties, get some professional help from a lactation consultant. It is worth the effort. Current practice is that immediately after the birth, you put your naked baby between your breasts and allow baby to be skin to skin with your body. A study done in Sweden in 1987 showed that if babies were left to their own devices for long enough, they would latch themselves to the breast, given sufficient time. There are pheromones in the nipple, which is like perfume that attracts the baby to the nipple. This can be an indicator of how easy breastfeeding is going to be. However, if you've had a difficult delivery, this may not happen with your baby. This time after birth, when they're alert and awake, is known as the magic hour. And often after that hour is over, babies tend to be sleepy and not so receptive. So to summarize, in the first hour after birth, put your baby between your breasts and give them an opportunity to latch. If they don't latch, then you may have to give your baby a little bit of help. One of the most important aspects of getting the breastfeeding right is the latching. Hold baby comfortably in your arms and pull baby towards your breast. Ideally, baby's lips should be flanged out, and tease baby's upper lip with your nipple. When baby gapes, supporting baby's shoulders, pull baby firmly towards your breast until baby is latched on. Try not to push baby around the head or touch around the face, as this can interfere with successful latching. It should not hurt to breastfeed. If it is painful, then the latch is probably incorrect. If baby is on the breast, take your little finger and put it in the corner of baby's mouth to break the suction. Take baby off and try again. Ideally, after a feed, your nipple should be a spherical shape. If it is squashed or ridged, this means baby's hard palate is squashing your nipple during feeding. Try getting more of the breast in baby's mouth when you're feeding. You can do this by pulling baby more firmly to you when you're latching baby on. Persevere with the feeding because most people have difficulties in the first month. Usually you find by the time baby is around 6 weeks old, feeding is going very well and it's not painful at all. Try to finish feeds in around an hour. Initially, baby will be feeding very frequently, 8 to 12 times in 24 hours. A good rule of thumb is to finish the feed after an hour and try settling. Otherwise you feel that you can be feeding all day. By 2 to 3 weeks, most babies will be feeding 2.5 to 3 hourly. And as they get older, babies get more efficient, and by 5 to 6 months, they're often only feeding for 5 to 7 minutes. Normal weight gain is for babies to lose about 10% of their birth weight and regain that by 2 to 3 weeks. You want baby to be putting on 140 to 200 grams a week. Most babies will double their birth weight by 5 months. Initially, you'll be feeding up to 12 times a day, and after an hour, if baby's still trying to feed, it's probably better to settle because you'll be feeding again in another 2 hours. After the initial feeding frenzies, babies tend to settle down, and by 2 to 3 weeks, they're often feeding around 3 hourly. As babies get older and more efficient with feeding, they'll only feed for 5 to 7 minutes by 6 to 7 months. Keep an eye on baby's weight. 140 to 200 grams a week. Weight gain is the norm. Most babies will double their birth weight by around 5 months. If your baby's weight starts to plateau, a simple solution is to wait baby for an extra feed. Factors that can get in the way of successful breastfeeding are having dummies, pacifiers or bottles in the first 2 to 3 weeks. If babies are having pacifiers and bottles in the first 2 to 3 weeks when you're trying to breastfeed, they can get confused because the process of feeding from the breast requires them to have a wide mouth and milk the breast with their jaw. When using a pacifier or dummy, one needs to suck with a tight mouth using your cheeks. In the first 2 or 3 weeks when babies are learning how to suck, this can confuse them. So it works well to establish breastfeeding if the babies don't have any dummies, pacifiers or bottles in the first 2 to 3 weeks. Another factor which can get in the way of successful breastfeeding is to restrict babies' time at the breast. Sometimes people try and feed to a routine. It's more successful to breastfeed on demand. Another factor that can undermine successful breastfeeding is having your confidence knocked by well-meaning relatives saying comments such as, "Oh, baby's still crying, so there must be something wrong with your milk." When you start on your breastfeeding journey, you often feel a little bit hesitant and full of self-doubt. As long as baby's putting on weight, otherwise well, a certain amount of unsettled behaviour comes with the territory. Try not to let comments like that put you off breastfeeding. Breastfeeding provides great benefits for you and your baby. But if it is not for you, you can still enjoy feeding your baby and holding them close. Thanks for watching, and I wish you every success with your breastfeeding journey. If you found any of this information useful, please like and subscribe. Next week, we'll be looking at adjusting to being a parent and parental anxiety. See you then.